Hi everybody, Jackie here with Dr. Bilski of Bilski Family Dentistry. How you doing today?
Great.
Good. Good. And so today we're talking about adult toothaches. I'm an adult, I have some pain in my jaw or in my tooth, it hurts, and you go to the dentist. What's going on?
So this is the most difficult part of a dentist's life, trying to assess what is actually the problem. Toothaches in adults could be temporomandibular joint dysfunction, which is TMJ. It could be just a bad bite. It could be a cracked filling, a cracked tooth. It could be a dying nerve. It could be infection.
Oh my gosh, so many things it could be.
Fortunately, it's somewhat easy to figure that out.
Yeah.
And with x-rays and technology, we can certainly figure that out. However, when we get some of these cases where it's a younger adult that doesn't have any fillings, we don't know if it's a cracked tooth, we have to go with the TMJ route.
Yeah.
So if you show the picture up with the, I think that explains it. If you've ever had a toothache, because it's nerve pain, that's what it feels like.
Yes.
If you have TMJ and you're feeling it more in the back toward your ear, that's the TMJ diagnosis that if we cannot figure out what's going on with the teeth. So it's not a crapshoot. It's just we need to know what's going on. We need symptoms. We need x-rays. We need to talk to you. Yeah. Give me your symptoms.
So if you're having a toothache, you need to get to the dentist right away.
Yeah, it's not one of those things, and we always say this in our own industry when we're sitting around drinking our coffees. Never met a tooth that had a crack or a cavity that cured itself or got better. Yeah. It just doesn't happen. It doesn't happen. So once that tooth is cracked, bacteria get in there. It's either going to ravage the tooth with decay or it's going to kill the nerve, and once the nerve dies, the bacteria, again, that's the recipe for the bad soup. It hurts. Yeah. And it's never forgettable. It's the most memorable pain you'll ever have.
And if you do get it to that point where you let that bacteria get into that infection, or you do just wait it out, it's really not a good idea. This is, the entryway to your whole body. It can really affect your health. It can be, seriously get worse if you don't get it checked out.
Exactly. Right away. There's multiple times where we've heard of patients. We had one in our practice where the middle school principal passed away from cavernous sinus infection, toothache, ready to go to the doctor. And then an actor on television, Andy Hollett, played Angel. He was 28, was in between jobs, didn't have dental insurance, thought he couldn't go to a dentist unless he had dental insurance. Turned out he had an infection that went into his heart.
Oh no.
So it decreased the function of his heart.
Oh no.
And at 28, he was debilitated. He could barely do functions like walking stairs, and eventually passed away at 33 years old. So in 5 years, his life was ruined. He lost it. So the price of not going could cost your life. And that's such an exceptional case. Yeah, you don't want to scare anybody. Right. However, it's very serious. And if you have a toothache and your face swells, you got to go to the dentist as soon as possible. It's in your body. It's going in your body.
Yeah. And you have to make sure to get that checked out.
Right.
And it could be a number of things, TMJ, a cracked tooth. And so to find out what it is, you need to schedule your appointment with the dentist. And you can do so right on Dr. Bilski's website at bilskidds.com. Thank you so much for talking to us about this today.
My pleasure. Thank you.